The next disorder in this category we'll cover is illness anxiety disorder. And so one thing to know is that most people who would have been diagnosed with hypochondriasis, which used to be a diagnosable disorder in previous editions of the DSM, are now classified as having somatic symptom disorder. However, in a minority of cases, the diagnosis of illness anxiety disorder applies instead. And so, according to the DSM-5, individuals with illness anxiety disorder have a preoccupation with having or acquiring a serious illness. However, somatic symptoms aren't present, or if they are present, they're only mild in intensity. But despite the fact that the person has been assured that they don't have a serious medical condition, they're still extremely anxious about their health and can be easily frightened about anything related to their health. So every cough or pain becomes magnified, indicative of some serious medical condition. Because of this concern, the person either performs excessive health-related behaviors or avoids doctor's appointments in hospitals for fear that something serious will be discovered. In order to account for these different reactions, we specify whether the person has illness anxiety disorder care-seeking type or if they have illness anxiety disorder care-avoidant type. Finally, similar to somatic symptom disorder, the preoccupation with the illness has to be persistent for at least 6 months. Furthermore, like with somatic symptom disorder, although the concerns of individuals with illness anxiety disorder may be derived from a non-pathological physical sign or sensation, the individual's distress is primarily due to his or her anxiety about the meaning, significance, or cause of the complaint. Next is conversion disorder, and as your book mentions, conversion disorder was made famous by the case of Anna O., who was a client of Breuer and Freud's, who experienced a series of bizarre physical symptoms, ultimately resulting in the paralysis and loss of feeling on her entire right side. So conversion disorder is diagnosed in cases when clients have one or more symptoms of altered voluntary motor or sensory function. And there are a lot of different ways this can look, but some are more common, which has resulted in a number of specifiers. So people can be diagnosed with conversion disorder with weakness or paralysis, with abnormal movement, with swallowing symptoms, with speech symptoms, with attacks or seizures, with anesthesia or sensory loss, with special sensory symptoms, which is simply when you have sensory symptoms, so vision, smell, touch, etc., or with mixed symptoms, which is basically just a combination of symptoms. Next, the DSM-5 stipulates that there has to be evidence that the symptoms are not the result of a recognized neurological or medical condition, that the symptom or deficit is not better explained by another medical or mental disorder, and finally, that the symptom or deficit causes clinically significant distress or impairment or warrants medical evaluation. There are also a few additional specifiers to help clinicians better describe the client's symptoms. So you can specify if the conversion disorder is being diagnosed based on an acute episode, which would be appropriate if the symptoms were present for less than 6 months, or if the symptoms occur for more than 6 months, we would call the conversion disorder symptoms persistent. In addition, because of some evidence that suggests that psychological stressors can sometimes cause the onset of conversion symptoms, we specify if the conversion disorder is with or without a known psychological stressor. And when it's with a psychological stressor, we would specify what that stressor is. So, for example, we might say conversion disorder persistent with psychological stressor involving the illness of a parent. The final disorder that falls under the category of somatic symptom and related disorders is factitious disorder. And there are 2 types of factitious disorder: factitious disorder imposed on self and factitious disorder imposed on another. For factitious disorder imposed on self, the diagnostic criteria involve the following. First, falsification of physical or psychological signs or symptoms, or induction of injury or disease associated with identified deception. In other words, the person intentionally makes up physical or psychological symptoms. Next, the individual has to present himself or herself to others as ill, impaired, or injured. So the person isn't trying to hide or cover up the symptoms, but instead is broadcasting them. Third, the deceptive behavior is evident even in the absence of obvious external rewards. So even when it's not obvious why the person is being deceptive, why they're faking the symptoms, the deceptive behavior continues. And fourth, the behavior is not better explained by another medical condition, such as delusional disorder or another psychotic disorder. The criteria for factitious disorder imposed on another are very similar. So again, physical or psychological symptoms are intentionally presented or created, but this time in someone else. The perpetrator presents the victim to others as ill, impaired, or injured. This deceptive behavior continues even when it's not clear what benefit the person is getting from it, and the behavior is not better explained by another mental disorder. And the perhaps obvious but nonetheless important part is that the perpetrator, not the victim, is the person who gets the diagnosis. And you can specify either type of factitious disorder as either a single episode or recurrent episodes. Now, in terms of treatment, the reality is that there is very, very limited research on effective treatments for these disorders. In part, this is because, as I mentioned before, these disorders are very difficult to diagnose and are often not diagnosed. However, what evidence does exist suggests that cognitive behavioral therapy may be effective due to the fact that some of the symptoms that exist, particularly for somatic symptom disorder, illness anxiety disorder, and conversion disorder, overlap with symptoms of anxiety disorders. So that's your description of somatic symptom and related disorders. Now go ahead and take the quiz.